When you're mentioning the kind of buffering in different ways, or different ways of looking to buffer oneself from the impact, one of the difficulties with that is when people are trying to protect themselves from their reactions. That's what we relate to as the kind of avoidance or numbing, where the downside of that is it stops the processing of it further. It stops the processing of the emotion. So it's natural to look to dampen the pain that goes through with thinking of a traumatic event. But that's where, what we've learnt in therapy processes or debriefing processes, the idea is to look to identify when people have been through an untoward event or a traumatic event where it's natural, where people would feel helpless. And early on, not necessarily immediately after, in the first few days after, sometimes people just need the practical support to help manage with a particular situation. But soon enough, for people to be able to acknowledge and talk about some of their reactions and have someone else interested in how the person's feeling, including their helplessness, including intrusive thoughts, including the difficulties that people are having, because otherwise the reactions can become buried. And with this, when I think of reactions that can become buried, I think even of traditional cultures, how they sometimes would refer to trauma, like in primitive tribes, they would refer, the shamans would refer to people's reactions in terms of being possessed by evil spirits and soul loss. And when you think of that, that overlaps with the dimensions of trauma. Possessed by evil spirits, well, that can be nightmares and intrusive thoughts and anxiety reactions and anger. And the soul loss can be the numbing and being more socially withdrawn, which is partly the person's attempt to buffer themselves from emotional pain, but also part of it is the reaction of being stuck with the helplessness. And then I think that, as you described in the last episode as well, and what you're partly describing here, when you talk about putting reactions to one side and then finding like a project, a lot of coming through trauma is people starting to feel some sense of agency again. There's some things that you can do to make a difference. There's some way of taking up a thread in your life, of looking forward or doing something now or applying yourself in some way. And that's where actually resuming routines can be important for people. But also to be able to acknowledge one's experience to someone else and have that witnessed, have that appreciated and understood. That can be powerfully helpful. But even apart from whether other people are going to understand and appreciate, it's also common, maybe almost too common, a bit almost too natural for people to also partly protect themselves by not talking about it because it is painful. So that can be like a subtle avoidance symptom sometimes, to think that others won't understand or they won't have been through this. But people might be in a position to at least empathise or listen or whatever. But I think often when people are feeling stuck with their reactions, that's where it is important to seek therapy.